Folks, thanks for joining us today. My name's John Dubas with Premier Marketing, and we'll be spending the next 50 to 60 minutes or so discussing one of our key carrier partners and the advantages that they bring to the table to us as a marketing organization, reaching out into the mostly Medicare community with coverages that they simply need. And so we'll be spending this time going through that process. You'll notice in the software package that there is a section for both questions and chat. We ask that you put your questions in the question box. We normally address them through the course of the presentation, but we want to make certain that we deliver upon whatever material is necessary for you to get your full return on the investment of the time that you have with us. And that includes recording this presentation, making certain that you have it for your review afterwards as well. And we will make that available on our website at premiersmi.com and on our YouTube channel as well. The marketers that you work with within our organization will have access to that link, and we'll make it available should you choose to access it in that fashion as well. You'll note that these presentations are delivered to a wide variety of agents. So for some of you, this might appear to be a bit remedial. For some of you, it might be a great review. And for others, it might be brand new material. So we'll start with a level set across the board and begin with who is Premier. We are a national marketing organization founded in 1968. That's part of the Integrity Marketing Platform. We're licensed in all 50 states, acting as an insurance wholesaler through independent insurance agents such as yourselves. And we do so at the contracts that are at the highest possible commission levels, with recruiting contracts available to those who qualify. And we do that through a full portfolio of products aimed at our target audience. And that includes the base Medicare programs, the Medicare Advantage and Medicare Supplement plans, along with the standalone Part D prescription drug programs, but also a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need plans. Long and short-term care programs are also part of the portfolio, along with disability income plans and the ancillary benefits that can make such a difference for you to satisfy the needs, specific needs of your prospects and clients, and create other opportunities that we'll talk about in just a second. When we look at the Medicare Advantage plans, it has the national carriers in there for your use across the country, along with many of the strong regionals that can make a difference for you in your market, with that same philosophy carrying over into the prescription drug plans. You'll notice in the vast majority of these, well, that's part of the contract with the MA plan anyway, except for perhaps the Mutual of Omaha program, which is for their prescription drug plan, separate from their other offerings, and Clever RX is a discount plan and not a Part D prescription drug plan. The Medicare supplements that we offer, well, it's a broad portfolio, and we have different marketing systems in play to help you be successful in that space. And same philosophy, once again, having the national leaders for you in the different ancillary space, which gives us not only that opportunity to satisfy the needs of our prospects and clients, but also create different marketing opportunities for us and our agencies, and another income stream for our agencies as well. And we want to do so through a communication process that folks understand. And so that means interpreting many of the acronyms that are part of our business. This slide is a screenshot from the CMS website. And look at that, 4,420 acronyms. I've been doing this for a long time, and every now and then I still got to reference, what did MICKEYMOUSE mean? Oh, wrong industry. We want to be able to translate and properly communicate with folks that we are looking to help in this area, because it's a broad area. When we look at the Medicare opportunities, you hear of the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day. And when you take that and look at that near exponential growth, we got to temper a little bit of that, because there are some folks that are delaying full access to their Medicare benefits for one reason or another when they're first available, more than made up for, however, by those folks that are under the age of 65 and accessing their benefits because of a disability. So it's a broad market, And we got to keep in mind with many of the ancillary programs, they aren't just aimed at the Medicare population. So this is a grand opportunity to market across our society and fill our T65 funnel as well. Because look at that, those numbers are just mind-boggling. And we want to make certain that each in the areas of their choices, we're able to help them with products that satisfy the needs according to the mindset and the opportunity that they present because of the different challenges or needs that they have once they enter the Medicare space. And we're able to do so all year round because, plain and simply, the majority of people on Medicare aren't looking at their coverages during the annual election period. That gives us a grand opportunity to address people throughout the year, whatever their base program may be, because we're translating, once again, that language. We're making the information that we send out very comprehensible to our products. And we're doing so because they're not accessing the government information sites. They're not looking perhaps at the Medicare and You book that they receive either through the mail or electronically. They're not using some of the other technical places that the government lays out for us to help people understand what's going on. So we want to deliver information to this market in the manner in which they are choosing to digest it. Sometimes that's with the sit across the kitchen table, shake hands, kiss babies, and get elected. Sometimes it's all handled virtually or a hybrid situation. However we're looking to do it, we are looking at a population that is becoming much more adept because they're being trained by all segments of our society. For the longest time, visiting a doctor was done through a Zoom call or another electronic means, and that is primary care specialist doing some of the preliminary work for a hospital stay or a dental visit, or even celebrating our faith was all done digitally. So we're able then to take advantage of a delivery system that is much more accepted, and that enables us to make certain that our most valuable resource, our time, well, it's expanded because of this technology. And we have to do so in the framework that the government gives us. One of the advantages we have with the programs we discussed today is the fact that they're not tied in to these election periods or the special election periods or the special election periods that are delivered to us by different carriers that help make us aware of these opportunities. We have, however, in these segments, folks that then are eligible for a change in their coverage, and that brings about the discussion for cross-selling and other programs that are made available to us. So that gives us the opportunity to bring in our friends from Medicare, pardon me. Boy, I'm really working up for this, from Medico to deliver upon information to help us in this market. So we have our friend Courtney Mayer to come on, asked her to come on and help us with this, deliver this information. So I am going to turn control of the system over to Courtney.
So I just kind of want to go over, why Medico. Maybe if you are not too familiar with us at Medico in general, I just want to talk about the reasons your clients are going to benefit from choosing Medico. We are a large company that is backed by the personal service of a small company. We have provided insurance solutions to people across the United States since 1930. So we've been in business almost 100 years now. And we are part of a financially strong and stable organization. All Medico companies maintain an A, which is an excellent rating and stable outlook with AM Best. That is a big question we get a lot of the time because, we are a smaller company. So people may have not heard about Medico like some of the larger companies that do a lot more advertising than we do. So we are very proud to say that we are an A-rated company. And then all of our employees are committed to helping make your job easy and ensure that your clients feel both respected and informed. That's a big one. Just know that when you call in or when your clients call in, they will always get somebody on the phone that will be able to give you the answers and solutions that you are looking for. So with all of that being said, let's start with our hospital indemnity policy. Our hospital indemnity policies, they were designed to help go hand in hand with your clients that have those advantage policies. When we're going through the slides here, you're really going to see that there's a lot of different options out there to really help go hand in hand, especially with those clients that have those $0 premiums on their advantage plan. You're going to see the value in these policies here. Now, we have our product available in all of the dark blue states that you are seeing here. You may have known, if you've been contracted with us, that last June, we actually went in and we did an endorsement on our hospital indemnity policy. What does that mean? What we did is we had the same great product that you were used to, but we went in and we added more benefits. One of those was a guarantee issue period between the ages of 64 and 67. And we will talk a little bit more about that in a few more screens here. But with our hospital indemnity policy, if you have somebody that is applying and they live with somebody that is over the age of 18, they are going to get a 7% household discount for that. On average, our hospital indemnity premiums are about 10% cheaper than our competitors. So just kind of keep that in mind. And we are also on the CSG platform. So if you want to go in and use that fill the gaps tool, we are out there as well. So our product here. Now, lots of different options that we're going to go over right now. So, because a lot of your clients, they may have, different out-of-pockets. They may have a $325, maybe they have a $400 a day. So we have pretty much everything for all of those clients. Our base policy can select from $100 to $600 a day, and it goes up in $25 increments. And then your clients can select the number of days, again, based upon what their current plan may have for them. They can select days 3, 6, 7, 8, 9, 10, 21, or a 31-day benefit period. With this, what is nice? Say you have a client that has selected the 6-day option. Say they use all 6 days. If they can be out of the hospital and carefree for 60 continuous days, we are going to reset them back to those 6 days again. As long as they are carefree for 60 continuous days, it will reset no matter what number of days is selected. The observation unit benefit. This is going to pay 100% of inpatient benefit for a max of 6 days in a calendar year. The emergency room benefit, $150 for a max of 4 days in a calendar year if your client goes into the emergency room due to accident or an injury. Inpatient mental health, we've seen this benefit spike with COVID. A lot of people were spending their time alone. They were really utilizing this benefit. It's going to pay $175 for a max of 7 days in a calendar year. And then our last one to round out the base policy here, and this is kind of unique to Medico as well. This is our transportation and lodging benefit. This is going to pay $100 for a max of 10 days if your client is having to travel more than 50 miles from their residence to receive treatment. So everything we just talked about, your clients are going to get when they select, say, 6 days at $250 a day. They're going to get all of this included. But what is nice is we have a lot of riders as well. I like to say these policies, they are designed for each individual's, their wants, their needs, and their budget. Because when we go through here again, there's a lot of different number amounts that you're able to select from to really help tailor these policies to each of your individual's clients, because not all clients' policies are the same that they're trying to, help supplement with these advantage policies. So the first one we're going to talk about, this is actually our most popular benefit rider that we have. That's our ambulance benefit. This is going to pay $250 up to 4 rides in a calendar year. And I say 4 rides because say you have somebody that lives in a rural area. They call 911. That ambulance is going to come and get them. They're going to take them to the closest hospital. Say they get to that hospital and that hospital's like, you know what? We're not equipped to do what we need to do here. We need to get you to another hospital, maybe in a bigger city. Guess what? They're going to put that patient back in an ambulance and send them to the next closest hospital that's going to be able to provide those treatments. So that's why we say 4 rides in a calendar year. The outpatient therapy and chiropractic service benefit. This is our buy one, get one. Who doesn't like to buy one and get one free for things? How it works is $50 a day for either 15 or 30 days for outpatient therapy. Now, I would like, just raise your hand, you know, you don't have to hit it on the screen, but just raise your hand if you've ever been able to quote this policy before. Because if you ever quoted it, you're gonna know that the premium difference is about 80 cents different to get the 30 days as opposed to the 15 days. So just kind of keep that in mind when you're quoting this rider to get your clients that 15 additional days for 30 days. There's not much premium difference. And then it's going to also cover up to 5 days for chiropractic service. The outpatient surgery benefit rider covers $250, $500, $750, or $1,000 per day, up to 2 days in a calendar year. That skilled nursing facility benefit rider. This is gonna, you can choose either $100, $150, $200, up to 50 days. What is nice about this rider is there is a one-time restoration of benefits. So if your clients can stay out of the nursing home for 180 days, it's gonna reset back one time during that life of the policy. The next one, our lump sum cancer. We're gonna kind of talk about it now, and then we're gonna talk about it because we have a standalone cancer. And why are we talking about it so much? Because the cancer rider on this policy, we always say because it's necessary. The cancer benefit rider is gonna be able to pay out in lump sums of either $1,000, $2,500, $5,000, $7,500, or $10,000 per lifetime. This is going to help cover, you know, some of those indirect costs. Or maybe the doctor says, you know what, it doesn't look good. You don't have much time. Maybe they want to go on one last vacation. This money that we pay out, they can use it however they best see fit their needs. Our urgent care center benefit rider. This is going to cover $50 up to 4 days in a calendar year. I don't know about where you guys are. Where I'm at, you go to the emergency room, no matter what it is, it seems like you are there for absolutely ever. Say you cut your finger, you need stitches, you can go to the urgent care. I had somebody tell me they went to urgent care, they were in and out with stitches within a matter of, you know, an hour as opposed to 5 hours that they may have set at the emergency room. And then our last one is our lump sum hospital confinement benefit rider. This is maybe if your client just needs a little bit more than that $600 a day, they can select one of these benefit amounts to pay in addition to their daily benefit. Now, we've gone over just a lot of information there, but I want to show you the value of this policy because, again, these were designed to help go hand in hand with those clients that have those advantage policies. So now keep in mind those clients that have those $0 premiums, look how inexpensive these plans would be. Now, this is a plan that has absolutely every rider on it. You know, more than likely, they're not going to select every rider, but this just kind of gives you an idea of the value that you would be getting. So for 6 days at $250 a day for a 65-year-old female with the household discount, it's $13.39 for the base premium. The ambulance benefit rider is $3.20. You can't even go get a coffee for $3.20 these days. Now I'm going to jump down to about the middle of the page here where it has the lump sum cancer benefit rider. For a $5,000 benefit for a 65-year-old female, it is $9 a month. Think about all of the things that we spend on in a month that end up in the trash can, or we lose, or I have a dog that sometimes likes to get things and chew things up. Think about all that money that we basically just kind of throw away when we buy stuff. But for a lump sum cancer benefit rider for $9 a month, you could get $5,000. So we have this worksheet available, and I will send this over to John so that way if you guys want it, you can have a copy of it. This worksheet is a great worksheet because up at the top, you're going to be able to go in and you can put your client's current health insurance plan copays. It's going to total it all up and it's going to give the total out of pocket. So they're going to be able to see what their total out of pocket is with their current plan. Then at the bottom, you will be able to go in and plug in Medico's hospital indemnity. Then it's going to show them the total that we would pay. So right there, give them the out of pocket, you know, sometimes people might say, oh yeah, that's fine. But when you're seeing, your total out-of-pocket costs are, $4,000 or $5,000 maybe, yeah, it's kind of an eye opener. Then at the bottom, you'd be able to see what Medico would pay if they had a hospital indemnity policy with us. Now, when we went in and we revamped this policy last June, we added a guarantee issue period between the ages of 64 and 67. So if somebody's between those ages, health questions, they're not even going to pop up for you. But these plans are issue ages between the ages of 18 and 85. So really anybody that has those high deductible plans would benefit from having a hospital indemnity policy. There's only 9 health questions on the application, and you're seeing them right here. We are only asking within the past 12 months. So if they used oxygen, treated or diagnosed with Alzheimer's, Parkinson's, MS, or COPD, diabetes requiring more than 50 units of insulin or 3 or more oral medications, that was a big one. We used to automatically decline for any amount of insulin. Now it's up to 50 units. Now, there is a 6-month pre-existing condition limitation. So anything that's pre-existing will not be covered within the first 6 months of somebody having a policy with us. And there is a 2-year contestability period. So if you have somebody that, is filling out those health questions and they file a claim within the first 2 years, we will order medical records just to make sure that everything was answered truthfully on the application. So that is the hospital indemnity portion. Now, let's go on to our dental insurance. So dental plans, a lot of Advantage plans, maybe they offer limited services for dental, but they're not going to cover everything that they may need. And chances are you have clients, they're turning 65, they're coming off of employer insurance. They've been offered dental previously. So dental is one of those things that they are more than likely going to want. But some people may not know that it's not going to be covered with their other plans that they may have. You are their new HR person. And a lot of times, maybe if it's not being offered to them, maybe they don't think that it's not out there and they don't know much about what's, if they're getting a lot of mailers, a lot of flyers, there's a lot that they may just think's included. So it's our job to teach them what is covered and what is not, and then to show them the dental products that we have available. So here is Medico's product availability chart. Anywhere that's in that blue color is where we have our gold and platinum product plans available at. And our plans, they're very easy. We have the 2 plan options, and we'll go over the benefits on our next screen here. But we have the option to add a spouse. So if you have somebody that is applying and they want to add their spouse, the spouse that is being added is going to get a 12% discount for that. We have first day coverage even on major services. That was a big thing that we had questions on when we were doing our dental policies. We need coverage first day. So we have that. We have 2 great riders that can be purchased. We have the buy-up benefits, or we have the carryover benefit. So the buy-up benefit rider, that's just going to add $1,000 of coverage. So if they have the gold 1,000, they purchase the buy-up, it's going to give them $2,000. If they have the carryover benefit rider, this is an extremely popular rider that we have. So if you have somebody, maybe they didn't use $500 of their benefits for that year, they could carry it over into the next calendar year, and they can carry it over each year until it reaches a maximum of $3,000. Very affordable rates. Our issue ages are 18 to 89, and it offers a multi-policy discount. So if you have somebody that has a Medico Medicare Supplement policy, or maybe our sister company is Great Western, if they have a Great Western final expense policy, and you wrote them a dental policy, they would get a 5% discount on their dental premiums for having a Medico Medicare Supplement or a Great Western, final expense policy. And when you're quoting these and enrolling on My Enroller, it's super easy. You're able to click multiple options, and then you can enroll in 2 products all at the same time. Now here is that nice product screen. When you're looking at these, very, very similar. So calendar year deductible for both plans, $0 for preventative, $50 for basic or major. Preventative services are covered at 100% for both plans, no waiting period. The difference that we have is right here is our basic services. On our gold plans, we are going to cover them at 50%. On our platinum plans, we are going to cover them at 80%. So that is going to be the difference between the two plans. Major services. So a bridge, crown, dentures, implants, surgical extractions, root canals, periodontal services. They are needing something like that done within the first 12 months. We will cover them at 20% within the first 12 months. After they have the plan with us for 12 months, we're going to bump that up to 50% of coverage for them. What is nice with our dental plans is there is no coordination of benefits. So your clients can use our plan in addition to any other plan they may have. So again, they have that advantage policy. Maybe it's going to cover a little bit, but it's not going to cover everything that they may need. They can purchase a Medico dental policy in addition to anything else that they may have. Also, your clients have the freedom of choice. They can use any provider that they would like, but if they use an in-network doctor, it's through Carrington, so it's a very large network, they would get a negotiated rate that that doctor has with being in the network. We really try to keep, your clients in control of their dental, because maybe they have a provider that they've been going to for the last 20 years. They don't want to change, and their provider's not in network. That's perfectly fine. They can go anywhere they would like, and then we would still pay the same percentages you've seen on that last screen. It's just the negotiated rate for a cleaning, maybe a little bit more for an out-of-network than an in-network doctor would have. If you want to take a look at the in-network doctors, there is a link out on our agent website if you are contracted with us. If you are not, there's also a link out on our public website that you can access as well, just to kind of see what networks or what doctors are in network, I should say. All right, now we're going to go on to our Medicare Supplement policies. So again, you're seeing the trend. Here's our product availability chart. Anywhere that is in blue is where we have our current products available at. With our Medicare Supplement, if you have somebody that is applying and they live with somebody that is over the age of 50, they are going to get a 10% household discount for that. When we redid these rates, about 18 months ago now, we did kind of a different approach. We are more competitive in our bigger cities than what we are in the rural areas. So just keep that in mind, when you're quoting those bigger cities, that's where we are going to be extremely competitive at. And with our Medicare Supplement plans, or the Medicare Supplement in general, I should say, you might have the clients that they're not quite sure, do they want a Medicare Advantage? Do they want a Medicare Supplement policy? Medicare Supplement policies really help your clients be in control of their health care. Where Advantage plans, they're more, the government's kind of in charge of that. So our Medicare Supplement policies are extremely competitive. If you haven't had a chance to take a look at that, please go do so. We are actually also now out on the CSG website for quoting, and you can enroll from there as well. So just keep that in mind, that you can enroll our MedSups on that CSG tool as well. All right, I told you we were going to talk about cancer as a rider and as a standalone policy. So first diagnosis, cancer. Some people may say, well, why? Our response to that is because it's necessary. So we're going to get into a little bit of the stats on the next screen, but our first diagnosis cancer policies have been around since 1980. So we're not new to the game. We've been around for a while with them. How it works, it's very simple. Upon a diagnosis of a qualifying cancer, a lump sum of either $10,000, $15,000, $20,000, or $25,000 is paid directly to your client, tax-free. Our policy only has 3 knockout questions on the application, and it actually has a 99% issue rate. Policyholders maintain that premium they have when the policy is issued. Issue ages are 18 to 79, and it only has a 10-year look-back period from a previous cancer diagnosis. Now, many people think that their medical plan will cover all expenses associated with cancer treatment, but 60% of total expenses are considered indirect cost and are not covered by health insurance. So cancer insurance is designed to cover some of those direct costs, but more importantly, the indirect expenses that add up after a cancer diagnosis. Medico's first diagnosis cancer plan can help be used to cover any type of expense that's incurred. The plan pays the policyholder upon diagnosis, and it can be used to protect any savings they have or to pay indirect costs like those increased during treatment, or I have a dog. Whenever we go anywhere, I have to kennel her. That costs money. It's snowing well, not right now, it's not snowing, but I'm in Omaha, Nebraska. It's wintertime. Maybe it snowed. They had to have somebody come shovel for them. Or maybe they go to the doctor and the doctor says, you know what, again, it's not looking good. You might not have much time left. They can use this money however they want to. And I've actually had somebody tell me that they had a policy holder that took the plan out because they took it out because if anything and they were diagnosed and it was not good, if it was terminal, they wanted to be able to do one final thing with their family that their family would remember as a happy time during everything else that was going on. So the importance of cancer insurance is it's necessary. You hear a lot of different stories that people say. My mom and dad had a friend that she got diagnosed with kidney cancer. Then she kind of joked and she said, hey, is it too late? Because she knew where I worked. She said, is it too late for me to get a cancer policy? Because it would really help me out right now. She was joking, of course, but that's just the thing. People know that they need to purchase auto insurance, home insurance, but sometimes, they might not necessarily think of cancer insurance, or they might think that their plan that they have is going to cover everything for them. So more than likely, if you bring up that cancer policy and if you talk about it and you kind of share experiences of, maybe a friend, a family member, more than likely, it's really going to get them thinking of how important a cancer policy is. And then this just shows you how affordable a policy is. So ages 55 to 59 are right up top there, and this is based up on a monthly rate for Iowa, female Iowa, with the 10% discount. It just really shows you how inexpensive these policies are. Again, think at some of the things that we throw away in a month that are, $18 for 55 to 59. I can think of a lot of things that, you buy, you're like, oh yeah, this is great. And then, a little bit later, it's in the trash can. So these plans are they're very affordable for what you would be getting. And again, here's our product availability chart. Anywhere that we have in blue is where we have this product available at. Again, there's a 10% discount on their premiums if they live with somebody in the same household that's 18 or older, and they both are issued coverage. They both have to be issued coverage in order to get that 10% discount for our cancer policy. Now, we've gone over a lot of things here. So we at Medico try to make it easy to do business with us. We have our agent website. This is where you are going to be able to get all kinds of information. So we went over all of Medico's products today. We have our product info tab out there. If you go there, there's different landing pages for each product. Out there, we have PowerPoints that you can use. So for our hospital indemnity, if you have a client, you can go out there and you can pull up a pre-approved hospital indemnity PowerPoint to go over with your client. We have one out there with notes, or we have one out there with just the pictures like what you're seeing here right now. We have on our dental, again, we have those PowerPoints available. We also have Facebook ads that you can take and put out on your Facebook page regarding Medico's dental. We have all kinds of information out there. So if you are contracted with us, please go take a look. If you have any questions, you can always reach out to our agent service department. They can always help you navigate our agent website here. But our MyEnroller, this is where you are going to quote from and you are going to enroll from. Last year, we went web-based, so you don't have to download anything. You can access it from the website, or you can just go to apply.myenroller.com. When you get logged in, you are going to be able to select your options. So say you have somebody that wants a Medicare Supplement and a dental policy, you will be able to click MedSup and dental, and you will enroll them at the same exact time. You don't have to do the MedSup and then go back and do the dental. You will be able to do all of those at the same time. So very easy process, very straightforward. My Enroller is nice because if something's not filled out that needs to be, it's not going to let you move on to the next page. We also have our new MyMedico app. This is designed for your policy holders. So it's getting close to the end of the month right now. Say you write a policy, they have an effective date of February 1st. Well, there might not necessarily be enough time for them to get their policy packet with their ID cards. So your clients can download the MyMedico app. It's going to give them access to their ID cards. They can view their plan coverage details. They can check claim status. They can find a provider. They're going to have your information in there as their agent as well. So if they have questions, they can click a button and they can call you. They're also going to be able to have access to support from our home office as well if they have any questions. So it's the MyMedico app. And as John was saying earlier, you know, if COVID taught us things, that was the technology side of things. Seniors are getting more comfortable with using technology because for so long, that's what they had to do. So we kind of went off that and we got the MyMedico app out for the policy holders here. Now, also I want to talk about, this is something new. If you're on the agent website, you might see a scrolling screen and you might say, hey, what's that? This is something new. So Medico has teamed up with VSP. It's an individual vision plans and Start Hearing, which provide full service, affordable vision and hearing coverage. And you can combine them with Medico's Medicare Supplement, dental, hospital indemnity, and first diagnosis cancer. So anybody that has any kind of a medical policy would have access to this. So for the VSP, it offers 2 plan options for one person, for an extra person, or maybe it's a whole family. And it allows immediate use of benefits after enrollment. And there's over 41,000 providers. It has maximum benefits at VSP Premier Program locations and covers unique prescriptions and materials. And then the Start Hearing. The Start Hearing, this can be, it offers discounts up to 48% on the latest technology, including hearing aids. And it features a year of free office visits, a 3-year supply of free batteries, and free warranty plans. And with this, for the Start Hearing, there's over 3,000 hearing network providers. So these are on the website. If you know, we don't offer vision and hearing, but we wanted to make sure that if our clients were needing that we had something that we could offer to them. So there's flyers out on the website. If you have questions, again, give us a call. Now I want to get to the good stuff here. So we talked about all of Medico's products. Now we talked about, you know, the different products that we have to cross-sell. We have a cross-selling agent incentive going on right now. It started January 1st and it runs through March 31st. So how it works is very easy. Any combination of dental, hospital indemnity, and first diagnosis cancer applications. So tier 1 is 5 through 14 apps is going to get you $50 per application in addition to your commission. And then tier 2 is 15 or more applications is going to get you $75 per application. You know, again, My Enroller is great because you can enroll people in multiple policies all at the same time, and you can earn extra money for that. But we didn't want to leave out our Medicare supplements because we have really extremely competitive Medicare supplement rates. So we didn't want to leave those out. So we also have our Medicare supplement incentive going on right now as well. Again, started January 1, goes through March 31st. How it works is a minimum of 5 Medicare supplement applications. And it can be a combination of either underwritten, open enrollment, or guarantee issue. But how it's going to pay out is $125 for an underwritten app, and then $25 for open enrollment or guarantee issue. So once they hit 5 applications, we're going to go back and we're going to start paying on that first application that was submitted. That's a question we get a lot. So once they hit 5 apps, we go back and we pay for app number 1 all the way number 5, and then they can earn as much until March 31st. So we have great incentives out there for the products that we have. And again, to quote, use my enroller to enroll. It's all right there at your fingertips. Now, that is what I have here. This is my information. I will send John the slides once we're done here, so that way if you want them, you can definitely have them. If you have any questions, I would be more than happy to help you with anything that you have here with Medico. And if you're not contracted with Medico, reach out to John. They would be able to get all your contracting done. You know, as I said before, I've been here for 12 years now, and Premier has been a top partner. You know, when I first started, everyone's like, you're gonna love the people at Premier, and that is so very true. To this day, they are the best people to work with. So I thank you guys for letting me join you guys here today.
Thank you, Courtney. I'll send you a check. Thank you. One of the questions that popped up, Jonathan, I'm going to cover that gaps tool in just a moment. So bear with us and we'll get that information over to you. In the meantime, I'm going to pull the screen back.
Okay.
And finish up with some different things. That's the only question that was out there, Courtney. So thank you for your thorough and entertaining presentation. Thank you.
I talk with my hands a lot, so if you could just see my hands flying, they were going.
Outside of the accolades that Courtney gave us is some of the different pieces of support across the spectrum of needed material for you to be successful in this area. And that includes electronic contracting. Now keep in mind, when we deal with Medico and the contracting, we're going to send you some direct links there to expedite the process. But this is a good place for you to create your agent profile, store all the information you need in order to be contracted with the different carriers. And that includes satisfying the errors and omissions qualification that's necessary. We provide discounts for those coverages for qualified agents. What makes you a qualified agent? Well, you got to contract with us. But this is a program you own. And as large as Premier is and all the different programs that we offer, we don't offer everything anywhere. I don't know of any marketing organization that does. This is a program that satisfies that requirement regardless of whom you contract through for different programs. Obviously, we want that to be with us, but we also want to make certain that we provide a service that enables you to do what you need to do to be successful in your own space as well. And that includes keeping your license up to play. So we have a discounted continuing education program through our association with WebCE to make certain that we take care of you in that area. And we also offer to agents an opportunity to take advantage of a modified guarantee issue disability income program on which you're paid a commission on a product for yourself. We want to make certain that as independent agents, you have a thorough benefit package as well. Great way to protect your ability to earn. Much as what I said when we started out the program, that today's presentation is being recorded. It will be made available on our website and on our YouTube channel, but we've got other programs out there that can help you market successfully as well. Courtney spoke of the wonderful programs that Medico offers. We have different presentations then that you can use in the community, either live or virtually, and they may appeal to different segments of the markets that you are pursuing. So check that out because there's a lot of great material there for you. And today's webinar will be there as well as soon as it uploads and we are able to put it on those two sites. We do also offer complimentary access to Medicare Center. Now, this is a program that has a lot of different components to it, and it includes a universal login to multiple quoting engines and other tools that are made available to you, including those powered by Connecture, Sunfire, and CSG. The CSG component that Courtney mentioned, well, you have the electronic enrollment process available through Medico itself. It is now also available through Medicare Center. And one of the things that you want to do with that is look at the CSG piece that's in there because it has that cross-selling tool. We have a recording made available to you that speaks to how that works. It's very simple. You can identify a Medicare Advantage program in the market that you're pursuing, perhaps the identical program that is for the person that you're visiting with. Obviously, that would make it more effective. And it gives you then the opportunity to take a hospital indemnity program and fill in those gaps that are part of a Medicare Advantage program when a person goes into the hospital. You can tailor it exactly to the dollars that are being asked of that individual and select Medico to be your hospital indemnity program of choice. It also has on that system the ability to quote the dental, vision, hearing programs as well. And I've got to tell you, Medico's program has been out there as long or before most of the other copycats that came along, and it is a great option for you to use. And you have the ability to share that information compliantly, because those are health programs, with a presentation for their Medicare Supplement plan or an MA plan that might be a choice for that individual. And you can do so compliantly because you can collect that scope of appointment and store it for that 10-year period. You can record the call and store it for that 10-year period and make use of those side-by-side comparisons that give you the opportunity to market effectively. And that includes the use of a personal URL. So you have a microsite out there available to you as part of your involvement with our organization in this tool that can help you penetrate the great market of the World Wide Web and have folks then shop on your site, enroll on your site, and you get paid on that business because it's pointed to you. The program also comes with a contact management system and a CRM that enables you to do year-over-year analyses very simply and easily because it stores all that information in there for you. And it also has within that CRM switcher tags. What's a switcher tag? Well, that's the folks that may be most likely to change coverage for one reason or another. So it identifies those individuals for you to help you prioritize your marketing efforts. Lead Center, we're going to talk about in just a moment, but it also has different resources in there to help sharpen your sales skills, different call scripts, different materials that are available to you in that area that can make you enhance your selling opportunities. Because it's not only having a great portfolio and getting in front of people, it's selling and closing. If we can sharpen our skills there, obviously, it's our advantage. It is available also on a mobile application. And to quote one of the former TV stars on the Medicare commercials that have nauseated the rest of us and subjected us to a whole bunch of additional compliance pieces, it's free. Thanks, JJ Walker. But the involvement with this program doesn't cost you a dime. Courtney talked about the wonderful incentives that they have as part of a producer with Medico. Those are listed on our website as well. And we want to make certain that you are aware of those incentives so you have the full compensation for your efforts. They may help you qualify for carrier trips, and they will help you qualify for incentive programs with our organization. That includes direct mail programs and the return of our producers convention. The pandemic had changed a lot of things for a lot of people for what, a 3 or 4 year period. Well, producers convention is back. You can qualify for that. And I got to tell you, I have heard great stories of these. I don't travel much any longer because of health conditions, but this is one you really want to shoot for. We do have different programs to help get you in front of folks, and we want to make certain that you are compensated in other fashions by different discounts on direct mail programs through our association with different lead vendors. And you can qualify 2 different ways, once for health programs and once for final expense programs as well, through these vetted vendors that have systems in place to make certain that you're able to contact those leads as quickly as possible when they're as hot as possible and track them through a system. We also have another program available that helps you plug in the holes in your calendar week to week through direct mail leads that come back that haven't been worked that give you an opportunity to make certain you have people to speak to each and every day. Now, the cost of these leads will vary from time to time and from area to area. It's a whole bunch of supply and demand, but it's a great way for you to actually fill your calendar with folks that have raised their hand saying, hey, get me some information on this. Our internet lead programs are through Facebook. We have them available for both final expense and Medicare. One of the things I want to caution you about when it comes to social media marketing is, hey, it's a microwave response on the part of a prospect. It's also an expectation of a marketing response quickly from you as well. I have a friend who got a lead at 2 o'clock in the morning. She called them at 6 o'clock in the morning, and the person had already gone someplace else. So we want to make certain that you're aware of the great things that social media offers, but also the demands they put upon you as well. Lead Center that I jumped through when we talked about the Medicare Center. This is a lead program, a multitude of lead programs available to you through different sources that we have, we with Integrity and Premier have created, that gives you an opportunity to do live transfers or leads put into that CRM that enable you to control the flow based on budget and some other considerations. Hey, can I handle this many leads? And we actually have sales on those leads in certain areas and certain times as well. So it's a great way for you to economically fill your lead funnel as well. That T65 locator that was briefly mentioned before, well, this is also a program that you can download to your smartphone, your smart device, whatever it happens to be, register. They're going to verify that you have a contract with us. It too is JJ Walker-ish, available free, but it enables you to look at some things geographically and realize that, hey, I'm stacking appointments in this area, one canceled. Who can I talk to now? There's no real community center of influence. I want to talk to some folks about Medico's dental program. I want to talk to some folks about the advantages of a hospital indemnity program through Medico. You can door knock for those programs. You can't for MA or PDP programs. Hey, the Med Sup is an opportunity as well. It lays out where those folks are based on the parameters that you set for that program. The referral program that we're speaking of, a lot of times what we do with a lead that comes in is we're so concentrating on that lead, we forget, hey, we can work referrals to start, during, and after as part of the sales process. It's also an opportunity to us engage our book of business by reaching out to them with perhaps an area where we're approaching them saying, hey, I've got a great dental vision hearing program that's come available to me. I want to see, do you know of folks that could really benefit from that? And you're indirectly asking them for business, but you're asking them for referrals as well. And when you have a strong program and a strong carrier that backs up what you're offering, you not only cement that relationship with the person that you've already sold, but also others that they're sending your way as well. We do all this because we want your business. We want to be referable to you. But these programs that we speak of today, one of the things that is a great advantage to them is the fact there's no certification in order to offer them. You just have to contract, be conscientious about knowing what the programs offer and putting them in play. So it's kind of the old line from, I'm paraphrasing, John Wayne in the movie The Cowboys. Slap a piece of bacon in that biscuit, saddle up, let's ride, because we're burning daylight. It's something that you can move on very quickly and enhance your entire structure of your personal marketing plan. So I'm going to check really quickly to make certain that we have all the questions covered. Courtney, you're clean. All the questions are covered in that area. I think we covered that cross-selling piece off of CSG as well. Well, at this point in time, what's left is to thank people. For folks that have done business with us here at Premier in the past, and I thank you for that business. We look to deepen that relationship with strong programs such as those offered to us all through Medico. For those of you that haven't done business with us in the past and you're looking into some of the programs that we offer, I thank you for that opportunity. We want to serve you as well and set you up with a subject matter expert with one of the agent success managers, the marketers within our organization. But for everyone who has listened to today's presentation, I want to thank you for the use of your time. It's your most valuable resource. We value that as well. And I thank you for spending part of that with us. Courtney and I both appreciate the opportunity to present these programs to you. So with all that said and done, until we are able to visit with you once again, I'm going to wish you good selling. Thanks so very much. We look forward to visiting with you very soon. And thank you, Courtney.